Welcome to Pharmacology Mini number 8, where we'll talk about anti-anxiety agents. Anti-anxiety agents aim to reduce feelings of anxiety and stress to a level where the individual can then focus and implement coping strategies. Indications for anti-anxiety agents include generalized anxiety disorder, panic disorder, obsessive compulsive disorder, social anxiety disorder, post-traumatic stress disorder, alcohol withdrawal, muscle spasms, seizures, and as anesthesia. The mechanism of action is if you are taking a benzodiazepine, it aims to enhance the inhibition of GABA in the CNS. And if you're using an atypical anxiolytic or an SSRI, it increases available serotonin and dopamine at the synaptic cleft. Examples of benzodiazepines often end in zapam. Examples of this could be alprazolam, and that's Xanax, diazepam, which is Valium, lorazepam, which is Ativan, chlorodiazepoxide, which is Librium, chlorazepate, which is Tranexine, oxazepam, which is Cerex, or clonazepam, which is Klonopin. The side effects and adverse reactions of benzodiazepines include CNS depression, so we would want to avoid use with alcohol and other benzodiazepines. Anterograde amnesia, which means lack of memory after taking the medication. A paradoxical response, which is actually where they develop more severe anxiety and restlessness after taking the medication. They can develop withdrawal, so we would measure that with the Clinical Institute of Withdrawal of Alcohol scale. And it can also lead to toxicity or overdose. So symptoms of overdose would be drowsiness, lethargy, confusion, respiratory depression, hypotension, and even death. The antidote to benzodiazepines is romazicon. Other treatments that we would do if we have a patient that comes in with benzotoxicity or overdose is provide resuscitation and airway patency as needed, monitor vital signs, and provide with gastric lavage or activated charcoal. Interactions of benzodiazepines include those CNS depressants. So again, that's alcohol, barbiturates, and opioids. Grapefruit juice reduces the metabolism of benzos, and highly fat meals reduce absorption of benzodiazepines. It is pregnancy category D and a Schedule 4 drug. It's contraindicated in those with sleep apnea or respiratory depression, again, because it causes respiratory depression. It's also contraindicated in those with glaucoma and should be used with caution in older adults, those with liver disease or substance use disorders. It may be given PO, IM, or IV. We would want to educate our patients to take a benzodiazepine with meals or snacks to avoid any GI discomfort. They should take it at bedtime because it does cause sedation, and benzodiazepines should not be chewed or crushed. There is a high risk for physical and psychological addiction with benzodiazepines, so we would want to educate our patients not to take larger amounts than what's prescribed. We would want them to know the symptoms of overdose and educate them on any interactions. We would educate them to keep them in a secure place and that it's intended to be a short-term use medication and not for long-term. Then we have our atypical anxiolytic, also called Buspar. Buspar is a specific medication that has self-limiting side effects, which means they tend to go away over time. And some initial side effects that we could see include dizziness, lightheadedness, agitation, nausea, headache, constipation, and suicidal ideation. It is a pregnancy risk category B, and it is not recommended to be taken while breastfeeding. We'd want to use caution in older adults, those with renal failure and liver failure. As far as interactions go, it does interact with MAOI medications, erythromycin, so we would want them to avoid any antimicrobial agents if possible. Can also interact with ketoconazole, St. John's worts, and grapefruit juice. As far as administration goes, it does take about 2 to 4 weeks for full effectiveness, and it typically has good effectiveness for about a year. So this should not be used as a PRN medication like the benzodiazepines can. As far as education goes, we'd want to educate them that there's a lower risk for sedation and dependency than a benzodiazepine, and that it should be eaten with meals and increased fiber and fluids. Then lastly, we have our selective serotonin reuptake inhibitors, or SSRIs. For more in-depth information on SSRIs, see Pharmacology Mini number 6 on antidepressant medications. Examples of SSRIs that we can use in the treatment of anxiety include Paxil. And not only does it treat generalized anxiety, but it can also treat panic disorders, OCD, social anxiety disorder, trauma disorders, dissociative disorders, depression, and adjustment disorders. Zoloft can be used to treat panic disorders, OCD, social anxiety, and PTSD. Lexapro can be used to treat generalized anxiety disorder and OCD. Prozac can be used for panic disorder, OCD, and PTSD. And Luvox can be used for OCD and social anxiety disorder. And that wraps up our medication mini on anti-anxiety medications.